بسم الله الرحمن الرحيم. الحمد لله والصلاة على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك أنت العليم الحكيم. My topic today is about continuation of complication of renal transplant, and here I will discuss the complication. Before we discuss the technique and how to optimize the ultrasound machine equipment. Complication of renal transplant occur in about 12 to 20% of patients. A classification can be different classification used as early complication or late complication. In the early complication, as here listed, acute tubular necrosis, acute rejection, arterial or venous thrombosis, obstruction, leak, urinary leak, drugs, complication, toxicity, infection, late complication, transplant artery stenosis, fistula, and chronic rejection. The long-term complications include many forms of glomerulonephritis, which may cause a recurrent disease in the transplanted kidney, although early recurrence and graft failure are rare. Another classification of postoperative complication, it is dependent on the perinephric collection, complication, parenchymal abnormalities, complication, abnormalities in the collecting system, vascular complication, and post-biopsy complication. Here we listed also the 5 groups of complication: perinephric, parenchymal, collecting system, vascular, and post-biopsy complication. Perinephric fluid collection complication, it is include hematoma, lymphocele, seroma, urinomas, and abscess. Perinephric collection are common occurrence and found in about less than 50% of renal transplant, and can be urine, can be blood, lymph, or pus, and we can see it by ultrasound. Minimal perinephric collection representing a small hematoma or seroma are unexpected post-operative finding. The clinical relevance of fluid collection depends on its composition, size, location, whether or not is exerting mass effect on the transplanting kidney or adjacent structures. Hematoma, it is occur in about 4 to 8% of patients, and it is present in less than 2 weeks after surgery, and it is located in the either in the subcutaneous tissue or around the kidney in the subcapsular or perinephric area, and it is also result from biopsy, can be acute or chronic or subacute. It is ultrasound, it is depend on the stages. If it is acute, chronic, intermediate hematoma, fluid, if fluid filled or with internal septation. Here you see the transplanted kidney surrounded by perinephric hematoma with septation. Urinoma, it is occur in immediate post-operative complication. Less than 2 weeks after surgery, it is serious complication. It is due to defect in the uretrovesical anastomosis. Appear as well-defined anechoic collection without septation unless it is infected or mixed with blood. Urinoma are extraperitoneal collection, and usually they are seen between the kidney and the bladder. A drainage may be performed by ultrasound guidance, and if there is high creatinine level of the fluid compared with the serum, concentration differentiate urine leak from seroma or lymphocele. So the urinoma contain high creatinine level, unlike seroma or lymphocele. A radionuclide scintigraphy also can help in diagnosis and differentiation. Most of the leaks are managed conservatively by percutaneous nephrostomy or understenting, or also by ultrasound intervention drainage. Here we see ultrasound. There is collection and collection and posterior to the bladder. Here there is also an CT scan with collection uh, of urine indicating that leak. Seromas are liquid collection are located superficially below the subcutaneous cellular tissue, and have no specific ultrasound finding, and there is a risk of infection of these seroma, especially in immunocompromised patients. Here, septated fluid collection noted uh, in the subcutaneous tissue with no increase in vascularity. Lymphocele most delayed complication occurring about 4 to 8 weeks after surgery, located between the bladder and the kidney. It is cystic, but the majority tend to have septation. It is due to disruption of the lymphatic channel during the perivascular dissection or disrupted hilar lymphatics. Usually asymptomatic, can cause mass effect, causing hydronephrosis or lower lymphedema. Percutaneous drainage is the choice of treatment. Here you see the transplanted kidney and with large uh, anechoic fluid collection consistent with lymphocele causing hydronephrosis. Abscess, but occur in the early postoperative period due to pyelonephritis or bacterial seeding of urinoma or hematoma or lymphocele. Patient has fever and increased white PCs, and this is can vary in the ultrasound from echo-free to complex echo-button mass lesion. Parenchymal lesion, can be diffuse, can be focal, diffuse like acute tubular necrosis, rejection, pyelonephritis, uh, focal tumors, abscess, cyst. Acute tubular necrosis is the most common cause of impaired renal function in the early post-transplant period, resolved within 2 weeks. Grayscale ultrasound findings are non-specific, resulting in graft swelling, decreased echogenicity, or obscured corticomedullary differentiation. Color Doppler ultrasound revealed elevated resistive indices and even loss of diastolic component. Here you see the transplanted kidney. It is swollen with loss of differentiation between cortex and medulla and loss of the uh, in diastolic volume. Collecting system abnormalities, hydronephrosis, reflux, urine leak, calculus formation, urethral tumor. Hydronephrosis, either due to extrinsic conversion, perinephric fluid collection, or due to renal calculi clot or anastomotic edema and urethral stenosis. It should be noted that anastomotic edema often results in a transient hydronephrosis of the transplanted kidney. Also, apparently, hydronephrosis may be a result from increased hydrostatic pressure due to full bladder. Evaluation after voiding can avoid diagnostic error in this setting. Vascular complication Vascular complication like renal artery stenosis, renal artery thrombosis, segmental infarction, renal vein thrombosis or stenosis, renal or iliac dissection, acquired hypercoagulability state. Here you see the renal artery occlusion with infarcted kidney with no vascularity. Here you see also the vein and the kidney. It is no vascularity in the kidney. Renal vein thrombosis more common than renal artery thrombosis and typically occur between uh, the third and 8 days post-transplant. Possible etiology include both surgical technique, compression of the renal vein, and the fluid collection or hypovolemia. The kidney may appear enlarged and hypoechoic and lack of Doppler signal in renal vein. The renal artery shows increased resistance and often reversed plateau of the diastolic flow. Reversal of diastolic flow can be also seen in acute tubular necrosis, and but the additional finding absent venous flow and the diagnostic for renal vein thrombosis. Treatment is performed surgical thrombectomy or catheter-directed thrombolysis has been successfully attempted frequently. Here you see the 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 renal vein thrombosis with reverse diastolic flow, and we said it is not specific, can be seen with renal vein thrombosis or can be seen with acute tubular necrosis. Another patient with renal vein thrombosis with no flow in the renal vein with reversed diastolic flow, indicating renal vein thrombosis. Another patient also with reversed flow with renal vein thrombosis. Renal artery thrombosis is a rare but serious complication that occurs less than 1% of cases. It's seen in the early postoperative period and usually results in loss of transplant. It usually results from surgical techniques such as kinking or tortuosity of the artery and or dissection of the arterial wall. Uh, Other causes include acute or hyperacute rejection, acute tubular necrosis, and hypercoagulable state. Renal artery thrombosis, as you see here, this is the area of anastomosis, and the renal artery is thrombosed with no flow to the kidney. Arteriovenous complication, after post-biopsy complication, arteriovenous fistula and pseudoaneurysm as seen in this picture. Here you see this is the mixed vascularity, and here this is the pseudoaneurysm. Post-biopsy complication, hemorrhage, heavy fistula, pseudoaneurysm, and infection. Thank you very much for listening. Hoping you see soon.